Well, we're getting ready to pull up to the hospital where I'm going to have my surgery today. It's Wednesday the 28th, and it's approximately, it's 11:30, and I've got to be there by 11:55. This is the hospital. This is where I'm going to. It's called Troy Beaumont. We're going to be pulling up to the west entrance. And just to the right inside the hospital is Area C. And that's where I have to fill out all my papers and everything and give them my ID to show that I'm the right person that they're going to do surgery on. So, wish me luck. Well, here goes nothing. My girl's grabbing a wheelchair for me. And I'll get out of this car, go in and take care of some business. Thank you, babe. Now that I've checked in, it's just a waiting game until they come and pick me up and prep me for surgery. This is my lovely room so far. Just got in here. Gotta do a little changing. They kind of got me tucked away in room number 2, waiting for surgery and get changed into my nightgown. Get ready to prep me for surgery. This isn't really my best look, but it'll do till I get out of here. My IVs are all in, prepping me for the heavy drugs. Smile, you're on video.
If you were climbing up ladders, I imagine you were pretty active.
I'm not active.
Is that what were you working, or was it?
Yeah, just doing some home maintenance.
Okay, alright, so no allergies, your vital signs all look pretty good today. Just some high blood pressure and some reflux. And your reflux is pretty well controlled? Mm-hmm. Do you take any medicine for it at home? Mm-mm. No, just something like over the counter, like Tums or something?
Right.
Okay.
And that's very seldom.
I was going to ask, my next question was how often do you find yourself taking it? Alright, perfect. Any of your teeth loose, chipped, missing? Those are all your own teeth? Those are very nice. Okay, so in order to keep you comfortable while Dr. Matsuzik is operating, it's going to be a general anesthetic. You're going to go to sleep completely. There's really no way we can do this without that, okay?
Well,
I imagine it's quite painful. Not now, but moving it around is probably quite painful. After you fall asleep, we will place a breathing tube in so we can breathe for you while he's working. That goes in when you're snoozing, comes out while you're waking up, okay? He wanted me to talk to you about a nerve block. Did we start to touch base on that while he was in the office, or?
Yeah.
Yeah. So what the nerve block is, so what we would do is we would do it on the right side, because that's where the bigger surgery is going to be.
Right.
So what it would be a catheter that you would go home with, and this catheter is delivering a continuous infusion of a local anesthetic, a numbing medicine. The nerve that innervates most of your foot you can actually see behind your knee here. So it'll get pretty much all of your lower foot except for the middle part here. And I'm going to do a single shot up here to get that middle part, okay? There are some risks with putting in this catheter. It is a poke. Risk of bleeding, you're low risk. You don't have any bleeding disorders and you're not on any blood thinners, so I'm not worried about that. Risk for infection, the entire procedure is done sterile right here in this room, alright? Risk of any nerve damage, we do everything under ultrasound guidance, so I can visualize the nerve and we inject the medicine around the nerve, not inside of it. The risk for intravascular injection, which means putting the numbing medicine into a vein or an artery, which is bad, we avoid again with the ultrasound because I can see those structures as well. Okay? And while I am doing this block, Heather will be giving you some medication through the IV just to kind of relax you, make it a little bit easier for you because it's not fun being poked.
Yes, I know.
Are you okay with that?
Yep.
Yeah?
Just gotta get it done.
Do you have any questions for me about any of this at all?
No.
How many days afterwards will
the catheter stay in?
Yeah.
So it can stay in as long as you have solution in your pump. And I think it's on average anywhere from 3 to 5 days.
Okay, that's good. Keep him as comfortable as
Because you're going to be off of your feet for a while, right? Because he's working on both, so
Now, will that make them tired at all?
No, it's
Okay.
a local anesthetic.
Okay.
The pain pills that you take, sometimes, I don't know if you've noticed, sometimes they make you a bit sleepy.
Mm-hmm.
So,
Which is great, because makes time go by quick.
yeah, you're still going to get those pain pills, but the pain pills plus this block together will help control your pain. Okay?
Now, can he have anything for nausea? Sometimes he gets
Yes.
nausea with the pain
We are
pills.
definitely going to give him, we're definitely giving you some anti-nausea medicine while you are sleeping, because we are going to give you some pain medicine while you're sleeping as well. So, to help fight that, we're going to.
What about for like
treat you.
after, like at home?
Usually we don't. That would be up to Dr. Matuzik.
Okay.
That's a very, very common side effect, unfortunately, with those pain pills is that nauseousness.
Yeah. Okay.
If the block works well, you shouldn't need as many pain pills. At
Right.
least in that very acute post-op, like right after surgery, maybe post-op day 1. Okay.
Okay.
All right.
Cool.
Anything else?
I just don't want to feel the poking and prodding.
I've got drugs.
So you better do a good
I've
job.
got drugs for you.
All right.
Okay. I'll move
So
out of
I
the way.
think, are we ready to?
I'm
I
ready
don't
for
want to have
lunch.
to kick or bite somebody.
You know, this.
At this point, I'm completely out of it. I don't remember anything from this point on. I don't even remember saying goodbye. Or them even saying I'm getting ready for surgery. But I guess I'm not sure I'd want it any other way.
Did you throw them out? No lab work, no beta blockers.
Just make sure you're untangled from your IV here.
The original idea was to be an in and out patient. But when I woke up in recovery, the pain was
Area D post-surgical.
extremely bad. And I chose to stay another night until we could get the pain under control. I'm live.
You're live.
I guess no more time at the hospital. These nurses are awesome.
I was gonna say he's speechless.
Almost.
He has nothing to say.
Not only do they give you a rub down, you're all good looking.